Professor Margaret Rowe is the Dean of School of Health and Society at the University of Salford. And Margaret serves on a variety of boards connected with health and well-being, social care and education. And she's a great influencer of our strategic thinking and our policy formation and ways of working when it comes to health and social care. Margaret has a great reputation, both regionally, nationally and internationally. And we're highly honoured to have you with us today, Margaret. Before you go in, just apologies to everybody else out there, the wider audience, if you think this is very Salford-centric. Yes, it is, because this is where we kind of devise the programme, but we do want to ensure that the lessons that we've learned here can be spread across Greater Manchester and even further afield. So without further ado, Margaret, we'd like to welcome you and hand over to you. Thank you.
Well, thank you, Jack, and what a fantastic introduction. Firstly, I've got to say sincere apologies in this world of technology that we've been living in for the last 8-9 months. I've never had a breakdown, and unfortunately this morning on a really important conference, that was my issue. So it seems a little strange to do a welcome address near the end of your morning session, and it was fantastic to hear all of the presenters this morning. So sincere apologies, but I'm really pleased to be here, and it is supposedly introducing this important webinar on tackling childhood obesity in Greater Manchester. But I think it might be some of the things I was going to say have already been said by some fantastic presenters. I think what I've been listening to really showcases the collaborative nature of professionals working together, medical, physical and social interventions that will really make a difference in young people's lives in tackling the challenges around obesity. It's great to see and fantastic for me to listen to academics who work in the University of Salford in nutrition, exercise and psychology, who have been working together in this area for quite some time and looking at the role of nutrition, exercise and behaviour as an approach to tackling obesity in children, young people and adults. It really has been demonstrated this morning that it is a multifaceted issue and that there are many contributing factors. But clearly listening to a number of public health professionals, the importance and the impact on poverty on young people. And one of the things you'll probably tell by my accent, I'm not from Greater Manchester, but what I've seen is the passion drive within Greater Manchester and particularly in Salford in really trying to tackle these major challenges. And it's fantastic that we're going to be one of the first cities to have the real living wage across all of our large organisations. And I feel really proud to be part of Salford in relation to that. And that was led by obviously the council, which is brilliant. This type of event is really important, I think, in bringing experts from different disciplines together to develop a holistic approach to tackling obesity. And what we've seen by the presenters is we've got politicians here, practitioners, policymakers, health, social care and education professionals and academics. But absolutely imperative is the role of the family being given the knowledge, the expertise, the advice, the guidance, and being able to address what some of these challenges are that they're living with and help education and training for our young people. I think it's been brilliant to see SIBA leading the way and co-creating such a fantastic conference, really thought-provoking about what we can do and how we can learn from what is going on in Salford and Greater Manchester that can shape national policy and strategies going forward. We need to be sharing evidence. We need to be looking at developing solutions that make a difference for young people's lives. We know this is a major issue, and what I've heard also this morning is that in certain areas there's been very little change. In some areas of our Greater Manchester, we've seen those issues and challenges become worse and greater numbers of young people with childhood obesity. But we have seen interventions that have really tackled these issues, and we've seen some some improvements. It's about how do we share that evidence? How do we come together like you are doing this morning and today, and really looking at what the evidence are and what the contributing factors are to make a really authentic partnership to challenge what is required in a multi-agency co-creating approaches. I think it's fantastic that the evidence that we are producing in Greater Manchester will help shape national policies. And I know from an academic point of view, you know, that are helping not only regionally and nationally, but actually internationally sharing this issue, because childhood obesity is a global pandemic. And certainly what we've seen in certain countries who have adopted in Western ways of eating, we can see a huge increase in the number of young people and children who have obesity, and not necessarily the knowledge and education and the partnership working to tackle some of these issues. So I feel really privileged to be here. I think it's more of an interlude, and I'm sure you need a break, but it's been fantastic to actually be able to stay on a conference and actually learn from real professionals and the importance of the family. That is absolutely imperative if we want to take this forward. So thank you so much, and I'm looking forward to learning more.